and pay respects to the traditional custodians of these lands. And I'll also acknowledge and pay respects to elders past and present, and extend that acknowledgement to any Aboriginal or Torres Strait Islander colleagues joining us on the call, or those who might be watching on playback. And when we're talking about stigma, we absolutely have to be thinking about racism and institutional racism that's been a history of Australia since colonisation, and similarly for any other colonised lands across the world. So we've got two fantastic speakers, James and Chris, and I'm going to hand over to my colleague Eleanor Karma from our centre to introduce them and set us up for a great session. Over to you.
Thanks. Eleanor, I'm also from the Centre for Social Research and Health. Sorry for the delay in the recording. That should have been set up automatically, so I'm not sure what happened there. And it's my job today to introduce our two speakers and just say a little bit about the format of today. So we've got Dr. James Morris, and James is a research consultant, behaviour change specialist, lecturer, trainer, and a visiting scholar in the psychology department at London South Bank University. And I'll also just plug his own podcast, which is called the Alcohol Problem Podcast. And that aims to explore the nature of problem drinking through a range of academic and lived experience perspectives. And we've also got Chris Gough, who is the Executive Director of the Canberra Alliance for Harm Minimisation and Advocacy, which is an alcohol, tobacco and other drug service delivery and advocacy organisation run by and for people who use drugs and people who use drug treatment services in the ACT. And Chris is also the president of AVIL, the Australian Illicit and Injecting Drug Users League, and identifies as a person who uses drugs. So welcome obviously to our two speakers and everyone here today. So the format of today is that James will do a presentation on his work first, and then Chris will do a bit of response and commentary to that presentation based on his own work. And then we'll open up the floor for questions, but just make sure that if you have any questions along the way, you can pop them in the chat and we'll get to those towards the end of the session. So thanks very much. I'll hand over to James to start his presentation.
Thanks so much, Eleanor, and thanks everybody for making the time to come to this session, and thank you again so much for the invitation. It's a subject that I'm really passionate about, and hopefully I can do it some justice. So the title of the talk is "Can Stigma or Disapproval be Used to Reduce Addiction?" And this essentially comes from some kind of recent debates where certain addiction figures have, advanced calls for stigmatization or disapproval as a kind of sort of different take on kind of a societal norm against substance use or addiction, and kind of called for them to be enacted as ways of addressing addiction problems. But myself and colleagues published a paper kind of pushing back on that, and I'm going to touch on some elements of that paper to kind of try and articulate our case for why we think we really need to be careful about ceding maybe to calls that might exacerbate stigma or have other kind of negative consequences. So I just want to start off by briefly talking about what motivates stigma, or based on some kind of perspectives. At least there's a lot of stigma theories out there, as I'm sure many of you are aware, but a very, very kind of important one is stigma power theory, Lincoln Phelan, and also kind of elaborated on really excellently in Imogen Tyler's book, The Machine of Inequality. But stigma power theory basically proposes that there's three main motives for stigma, and one is kind of keeping people down. So we see this through, people or groups of power being motivated to oppress or discriminate other groups for a whole wide range of reasons. And another motive is keeping people in, which means, enforcing social norms, policing behaviour by kind of signalling what isn't and isn't acceptable. And then another kind of motivator behind stigma is keeping people away. So in some senses, this can be understood as when keeping people in fails, when people's behaviour isn't compliant with social norms, people might keep them away or discriminate them against them, and that's kind of keeping people away. But stigma is also driven by, or can be understood in different ways, including emotional drivers. So when people feel anger or disgust, they might, stigmatize people. And these arguably are driven by evolutionary goals like cooperation and disease avoidance and kind of mate attraction and so on. But it's also really important to understand that stigma is embedded within power structures. So it's not just prejudice or negative attitudes or stereotypes. It really is about the enactment of power and how certain groups use that power to enact stigma against others. But keeping people in is kind of the focus of the topic that I'm going to address. Essentially, this is when society or groups signal what behaviour should or shouldn't be conducted in a society. So one of the calls that's been made has been in this article in The Atlantic, which is a pretty widespread online media platform. And yeah, you can see the title there, but essentially a quote from it kind of gets to the root of what they're arguing here is destigmatizing the use of drugs that are destroying their life is a profoundly mistaken approach. Cultural disapproval of harmful behaviour can be a potent force for protecting public health and safety, as the examples of increased stigma against drunk driving and tobacco smoking show. We need more reflexive, more visible and more consistent rejection of drug use, not less. And yeah, one of the authors is a very well-known prominent figure and in policy and academic circles. But what I'll focus on more is a slightly more nuanced argument, which is that of justified disapproval. So this author, Vanyakov, has argued that this needs to be understood as something different from stigma. And disapproval is kind of a negative societal reaction that should be harnessed, according to Vanyakov, because negative societal reactions are argued to encourage quitting of harmful substances and help people refrain from engaging in substance use in the first place. There's many issues I have with that sentence on its own, not least the assumption that substance use is somehow inherently bad, as it seems to be conveyed there. But the point that we'll stick to really is this idea that, or argument that it's the growing leniency of social controls, so the relaxation of social controls that has caused rising substance use and related problems, according to Vanyakov, and in turn, that social disapproval, societal disapproval needs to be capitalized on in dealing with addictions. So the argument is that we need society to disapprove of substance use or addiction more in order to address the harms and consequences for society. Just a quick important additional note is within the arguments that Vanyakov makes, he argues that a disease model of addiction is wrong, particularly because it takes away responsibility from the individual. Now, I'm not an advocate of the disease model. I don't think the evidence supports it, but it's a complex but different debate. But this is important in the sense that he's arguing that essentially substance use is within people's control, and therefore if we disapprove of that behaviour, it's within their control to act accordingly. What about the theoretical rationales underlying disapproval? So the main one really is social norms theory, and according to social norms theory, there are two types of norms which shape behaviour. Descriptive norms are essentially what people think other people do. So if if people think that it's normal to litter or to do, you know, certain types of behaviour, the idea is that they're more likely to do that themselves. Injunctive norms are not about what they think other people do, but rather what they think they ought to or should do. So an injunctive norm would be, you know, you shouldn't litter. It's not a responsible thing to do. And disapproval is essentially an injunctive norm, a belief that society holds that certain things are disapproved of. So simply put, social norms theory says people behave according to conformity, the kind of need to fit in and be kind of maybe responsible citizens, and also value judgments, how other people will deem their behaviour as either good or bad. Another sort of rationale underpinning Vanyakov's argument is that addiction might be understood as a failure of guilt. So when people engage in a harmful behaviour, if you know, for argument's sake, define addiction as continuation of a behaviour that causes harm, it might be argued that people do that because they're failing to anticipate that they're going to feel guilty or remorseful about that in the future. So anticipated regret is, you know, the idea that if people anticipate regret towards their actions and may in turn feel guilt or shame, then that's a kind of important behavioural break on things that we might not want people to do. But our paper here, you know, argues what level of empirical support is there for disapproval in the case of addiction. So just to run through what we think, what we've assessed as the empirical case. So what does the evidence actually tell us based on observed data? Well, in broader behavioural domains, so if we look at outside of substance use and addiction, things like exercise and diet, social norm interventions can be found to be associated with small effect sizes. So they have small effects on behaviour, but obviously other things we know have much larger effects. So environmental changes and, you know, changes in the environment or availability of products or services are obviously the most well-known influences on behaviour. But many studies actually identify mixed, negative, or, you know, harmful counter findings on the effects of social norms. So sometimes social norm interventions are designed to encourage a certain behaviour, but might, you know, some studies have shown that they actually produce the opposite intended effect. And this is the case in alcohol, where there's the largest social norms literature for substances or addictive behaviours. But evidence, importantly, also suggests that people's in-groups are actually much more influential than the societal norms. So if you think about someone who, you know, might drink heavily, the kind of group, their peer group, their kind of social peers, the views and perceived norms around that group is much more likely to be an influence on their behaviour than what they maybe think broader societal beliefs are. So yeah, I'd say here that the social norms theory support for disapproval is not very strong. What about anticipated regret? Well, it's one of several proposed emotional-based mediators. So yeah, there's various different emotions that are involved in behaviour, including addiction, and again, mixed evidence in terms of what kind of what we see in when we look at this kind of anticipated regret applied to a range of different behaviours. Some studies maybe show that anticipated regret can have positive or pro-social behavioural effects, like they increase or decrease the behaviour in the desired direction, but some also the opposite. And systematic reviews of guilt and shame in alcohol use disorder both point to, in some cases, a possible protective effect in people that don't have alcohol use disorder. So it might in some cases prevent people from uptaking harmful alcohol use. But amongst people with alcohol use disorder, problem drinking, guilt and shame seem to actually have a harmful role, that they exacerbate the condition and make things worse. But there is an interesting study that, for instance, in the case of smoking specifically, manipulated shame and found that this did result in effects on people's likelihood to seek help for smoking. But this worked in both directions. So people in higher socioeconomic status were more likely to seek help when shame was induced, but people with lower socioeconomic status were less likely to. So Vanikov actually argues in his piece that the declines in smoking are an important example of why disapproval works, because basically decreases in smoking, he argues, have resulted from the internalization of the beneficial and increasingly widespread societal disapproval towards smoking. However, as we argue, this kind of it makes a hugely important omission, which is that legislation and environmental drivers have been really important in smoking declines. So just this graph just shows the relationship between rising cigarette prices and decreasing sales, and in the US, and we have evidence, across the world that, legislation and tobacco control initiatives are really important in driving smoking declines. So in some cases, behaviour is changed first and then people's attitudes follow. And we might think about, certainly in the UK, when seatbelt legislation was introduced, people were, on the whole, very strongly opposed to it and felt it was an infringement on their civil rights. But similarly with public smoking bans, once the initial kind of panic was over, people's attitudes actually aligned with their behaviour, and now we have widespread support for people being required to wear seatbelts and not smoke outside. Okay, so where does this leave us? We argue that essentially addiction is a misguided target for disapproval. Vanikov's claim that disapproval is suitable because of its voluntary nature, again, going back to this argument that it shouldn't be classified as a disease. Vanikov argues this because he says users maintain free will to do that. But this kind of idea of addiction as completely within a person's control certainly overlooks most contemporary scientific understandings of addiction. And, I really like this conceptualization of the puzzle of addiction by Hannah Pickard, which really talks to the complexity of addiction and why it's such a difficult issue to address. It's just such a complex, multifaceted problem that any kind of single avenue to addressing it isn't going to be effective. But it's important to recognise that normative influences, social norms, might be valid for substance use where addiction isn't, because we do know that social norms do influence or can influence behaviour to some extent in a general sense. But yeah, certainly in the case of addiction, the addiction science really shows that this kind of idea of it either being a disease which people can't control, or it's completely within their free will and is a kind of moral failing, neither of those stack up, and the answer is just obviously far more complex. Having said that, it is important to acknowledge that there is a fair amount of literature in terms of how recovery happens, whereby guilt and shame are involved in the process of recovery, as well as being harmful components of kind of addiction. But when people do recover, often people do come to accept that the addiction itself was a problematic or negative thing. So they adopt a kind of negative appraisal of addiction, and to basically acknowledge that kind of shift changes often reflects an identity shift, where people, where the identity of maybe using drugs is part of the kind of the process of harmful substance use, but recovery may involve a kind of positive identity shift into one where kind of substance use isn't regarded in that way. So I'm trying to say that negative evaluations of substance use are still important to consider, and these can obviously be influenced by social norms. But really importantly, if we're thinking about how they may influence behaviour, it's really important they don't threaten people's concepts, so undermine their self-worth in the way that self-stigma does. And it's also really important to recognise that certainly in addiction, self-efficacy is really, really important. So if people don't feel confident to change a behaviour, it doesn't matter, what's going on around them or how disapproving people are. If people aren't confident to change it, or enabled or supported to do so, it's going to be very difficult. Just before I kind of get to the kind of conclusion, we have a pub lab in my university. So obviously, we're advocating for an empirical, evidence-led assessment of this question. So we set up a study that hasn't been published yet, it's under review, but I thought it would just be useful to highlight that within a pub lab setting, so a mock pub, we expose people to this kind of, or in one intervention group, a kind of statement that was designed to kind of signal societal disapproval. And then we tested their drinking, their level of consumption in a kind of sham taste preference task. So they thought they were evaluating drinks based on their taste, but we were actually measuring how much they consumed. And there was a control group as well that didn't get this message. And the results were basically that there was no difference between people looking at the disapproval message and the control message overall. However, when we factored in people's drinking identity, how important it was to see themselves as a drinker, then this did have an effect. And basically what happened was people exposed to the disapproval condition actually drank more when they had a stronger drinking identity. Essentially, what this likely points to is that people's drinking identity felt threatened and they in turn drank more to reassert that identity. So essentially the message backfired. It had the opposite effect than would be predicted by those perhaps arguing for disapproval. So just to kind of conclude, what does it actually mean to implement justified disapproval in practice? What does it look like to increase societal disapproval towards addiction in a way that will supposedly reduce addiction or its associated harms? And particularly what messages or disapproval interventions would actually not have no effects and waste resources, or would not have backfire effects, as our study points to, and would not importantly incur the harmful stigma consequences, particularly for those already stigmatized or harmed through the kind of addiction and other intersectional problems associated with it. So it's important, I think, to remember the strong tendencies or kind of inherent, arguably evolved motives for society to stigmatize addiction. But these might be driven by power motives or emotional responses. And yeah, I think it's really important to kind of ask that deeper question of whether, calls for disapproval are being motivated by the same thing. And yeah, those are not the motives that we should be pursuing disapproval on. We should be looking to the evidence to look at what actual results are likely to occur. And just importantly, drug policy, largely fails to take an evidence-based approach precisely because of societal pressures. For instance, people don't want to condone drug use, and so you could argue that the illegal versus legal fault dichotomy is unevidenced, based on kind of social norms rather than kind of an evidence-based approach to what actually would work to reduce harm. So just finally, the onus should be on disapproval advocates to address these concerns with empirical evidence. I think I've presented some, a fairly strong case to say that we need to be very cautious, and there's a lot of risk of harmful consequences, and perhaps a call for people to be really critical about any kind of motives that might ostensibly want to increase disapproval or stigma, and really raise awareness of the harm that stigma does and the risk of unintended consequences of changing social norms around this. So thanks very much for your time, and yeah, I look forward to questions a bit later.
Thanks so much, James. That was really fascinating. As I've mentioned in the chat, if you're having trouble accessing James's article because of paywall issues, I've put my email there and you can just get in touch with me and I'm happy to send you the copy. I'll pass straight over to Chris for his commentary and response.
Thanks, James. That was great. I'd just like to acknowledge that I'm coming to you from the unceded lands of the Ngunnawal people in Canberra, and acknowledge the effect that the genocide of Aboriginal people in Australia has had on their culture, and that we need to go forwards with that firmly in mind, and that reconciliation really isn't enough. We need to be looking past reconciliation towards meaningful change. Wow, where do I start? So I guess first of all, just to start off, this is a really difficult conversation to be in. Can you guys hear me? Yeah. To be involved with from someone who has been heavily stigmatized for the majority of their life. And I can't help but see a lot of parallels with some of the other conversations which seem to be happening across the world, and attacks on human diversity that are happening, particularly across America in terms of LGBTIQ people, and also with the conversation on racism. So I'll be just giving you some brief reflections on what James just talked about from the perspective of someone who is the executive director in a small organisation that runs a drop-in centre in Canberra for the most marginalised community members in Canberra. We see between 80 and 100 people who are mostly people who use drugs, a lot of people who use alcohol as well, and then with different levels of marginalisation and stigmatisation, including Aboriginal and Torres Strait Islanders, women, and we work really hard to make sure that we provide an atmosphere which does the opposite of stigmatise, which is supportive, which builds empowerment, which builds social capital and builds education. So when I look at a conversation like this, even just the ability to have this conversation is coming from a place of privilege. A lot of people in society simply don't get the chance to even think about the differences between stigma and disapproval and whether they're negative or positive. They just get faced with stigma, which leads to discrimination constantly. So we need to really be sure in our minds, I think, that this is a privileged conversation, and it's our duty, therefore, to make sure that we're conversing in a way that's respectful, but which has maximum impact onto those negative effects that are occurring on people with disadvantage. I guess there's a number of underlying issues that James touched on: the idea of choice in substance use, the idea that disapproval in some way can be separated from stigmatization. Certainly we can theoretically separate the two, but when I look at the people who come into our drop-in centre and the problems that they face, I don't believe that there is any real difference between disapproval and stigma in the way that people are looking at them. And I don't believe that the two could be taught to healthcare professionals, for example. The difference is explained, and also, frankly, I doubt that even if disapproval could be taught, that it would have positive effects. I believe that the end result as it cascaded through our healthcare system would be that of stigmatization and then finally discrimination. So what I mean by that is that the world is full of stigma at the moment, and the world is also full of kind of that lesser stigma, which is kind of disapproval. And so in some ways, to say this is a revolutionary idea that we should be using stigma to control people's drug use doesn't reflect reality in the fact that that is the norm. Stigma is the norm in society. And so to some extent, we're talking from authors who say that we should use stigma as this kind of tool aren't really living in the reality of a stigmatizing world that continually uses disapproval to try and stop people from using drugs. And we are, in fact, I think, seeing the negative consequences of stigma currently. So to postulate that in some way we're going to kind of rebrand stigma and use it as a positive influence, I think the whole world is evidence that this doesn't and can't work. I tend to think that this is part of the problem with gathering empirical data and then analysing it, is you can look at the same data and have diametrically opposing opinions on what that data means. And so if you look at things like the decriminalisation debate in Canberra, we have people who looked at the harms of drug and alcohol use, the overdose rate and things like that, as a means of saying this is why we should criminalise drugs more severely and why decriminalisation is a bad idea. And we had people who were looking at it and saying this is exactly why we should decriminalise drugs. And, so I think I'm not sure how far data will get us down the road of kind of proving or putting away the idea that stigma, can have positive influences. So look, I know that's been a little bit of a ramble, but from a lived experience perspective, this is a highly problematic area. It's really triggering. It's been quite difficult even just making it to this meeting to discuss, because it's just so emotive. There is just so much ingrained stigma in society, which it seems is really difficult to fight. And so to lean into it and to kind of use what I consider a fairly false narrative of stigma being positive, it really does lean into a lot of the kind of what I see as being a really ethically bankrupt way of viewing the world, in terms of fighting diversity within humanity, and from a very privileged position, and with no recognition that really, to a large extent, the issue of stigma is one of class. So that would be my initial thoughts on the. And the last thing I'll say is I even hesitate to give this conversation oxygen, to be honest. I think there's, and I understand why we're doing it and I understand why we're here, but, with what's going on in society at the moment, the people who come into Karma every day to seek help just to survive for them, this conversation is something which is not of the real world. I'll leave it there.
Thanks so much, Chris. And, you know, we really appreciate the emotional labour that goes into being part of this type of conversation. And I just want to put a sort of an editorial comment in here. What I loved about reading James's paper about someone else's writing was really unpicking the evidence, the complicated, deep evidence around this notion of justified disapproval, because other powerful voices in the addiction sphere had written this article for The Atlantic, not a peer review paper, and come at it in a very particular way and without going deep into the evidence. So using that notion of privilege of these other writers saying, you know, we've gone too far and we should be using stigma, or if not stigma, disapproval principles. James's paper unpicked, well, is there any evidence for that? And I think the short story is no, there's not evidence that disapproval is useful. So contrasting that, or putting it together, Chris, with the picture you painted of the people coming into the Karma Centre, and they don't have the luxury to distinguish themselves between disapproval and stigma, and how those concepts might get twisted and banded together in practice in healthcare and just become stigma anyway. This is a really useful conversation to give us all the ammunition when we come up against those kinds of attitudes of, well, disapproval works and we should be using it to stop these behaviours. We want to use this discussion and these tools for us to help make those conversations more evidence-based, and evidence also including the experience of people living in those situations on the ground right now. So James and Chris, with that kind of editorial, does that bring together what you think this conversation is about, or do you have other bits that you want to put into that?
I guess just before James talks, if I could just say I totally understand why this conversation is happening and appreciate it. And James, I really enjoyed reading your article, and it's what I was saying is in no way a personal criticism or saying that you're wasting your time or anything like that. There's absolutely a place for this, and it's very, very important to rebut what I consider a really toxic narrative. Yeah, so my apologies if I went a little bit overboard there, but
no, it's all good. Yeah, no, I definitely didn't take it in any way as a personal attack, and I think the point that you make is absolutely spot on. That that those kind of claims, are only going to hurt people with addiction, experience of, battling addiction or whatever, to use kind of terms that in themselves are wrapped up and embedded in very complex implications and ideas. But yeah, like if there is a kind of role for disapproval, I think what for me I got out of going through that long exercise, and a privileged exercise to go through in a way, was that it's not going to work, it's not going to help in the case of addiction. I guess the idea that it might work in the case of preventing uptake of harmful substance use is the one that has some more validity. So I don't know, as an example, if people go to university and it's very socially normalized to drink really heavily, then that's a kind of maybe a more valid way of thinking about, or maybe like social norms are important to consider. But I guess the really important thing is to say that's not an argument for saying stigma in any way is okay. And there was a reply to the original piece from Patrick Corrigan, who's a kind of godfather, if you like, of kind of stigma, particularly in the mental health field. But he just really hammered home the point that stigma is harmful. There is no kind of way in which we can say stigma is a force for good, because by its very nature it is a harmful practice. So the idea of disapproval is complex, because it's trying to say, well, there's something different, which is essentially, I think, what we call social norms. But yeah, I think to come back to the point, yeah, for people with addiction, yeah, stigma is only a bad thing, and we've got to be really clear about that and resist anything that kind of might tempt people to think that they can stigmatize people and call it a good thing.
So there's been a couple of, there's lots of love for you in the chat, Chris, if you want to go and pick that up and take it with you. And a few questions about the some of the references. So I've put a few things in, James, but if you want to add anything else, of course, go in and do that. So please jump in. We are in a sensitive area, but want to hear how people are responding to this type of discussion and the points raised. Lauren, I can see you've put a comment in. Do you want to turn your camera? There you are.
Here I am. Thank you both. Thank you, James, and thank you, Chris. And I mean, I find these kind of conversations extremely meaningful for researchers working in the sector, because we do come from kind of a privileged position where we surveying people or looking at our theories and think, how do they best apply to this kind of marginalized group out there, which is not us. And so I guess for me, it just reinforces the idea that we need to be sure that what we produce doesn't reinforce or kind of to trying to create positive outcomes for. And I think the key to research is to ensure that we always have perspective from community and from those with lived experience involved in our research. So I think this is really good. I think the theory is really good and the papers are really interesting, but it's also interesting for us to reflect on the broader consequences of the work that we do.
James or Chris, do you want to comment on that?
Yeah, like as a, I agree. I think it's really, really important. But I think I would add to that, informing as someone looking into the world of research, but also involved with research, from a participant through to doing research co-design. I guess the only thing I'd add, Lauren, is that we all need to be really cognizant that the effects of our research have to be meaningful for the community that we're researching, and so in that sense, I can directly see that although it's difficult to engage in a conversation like this from a person who's been stigmatized, it's important to make sure that we kind of rebut these ideas and make sure that we're focusing on empowering community members, providing education, enhancing social capital of marginalized people, making sure that the services that our healthcare systems and our social systems are providing a supportive, empathic, understanding. And it's only and I think really by that type of research that we're going to start affecting social norms and really sidelining stigma. The other thing I'd say is that without legal change, we've got an environment where it's legal to stigmatize and discriminate against people who use drugs. And so we have these big ticket items, which which we need to, as researchers, be looking to build evidence to make those systems better.
James, did you want to jump in at all, or okay?
No, just briefly, and what motivated me to write the paper was, feeling like strongly that this argument was harmful and wanting to rebut it, with an academic kind of hat on, in the sense that, yeah, the evidence matters, of course, but also, academia can be in a bit of a bubble or an ivory tower, and often struggle to interact with policy and lived experience sufficiently. And that's why I would jump at an opportunity to come and talk about it somewhere like this, and want to keep conversation to keep going and not just remain within academia. So yeah, no, I just welcome all the input and hearing the perspectives of it, because I just think it does matter that we must have a rebuttal to what might otherwise be seen as ammunition for stigmatizing practices. And yeah.
And just to say, the article in The Atlantic, I'm sure, would have had a lot of views on that. And so it's really important for those of us who see ourselves as allies to use our privileged positions to argue back on that. So thanks very much, James.
Megan, I can see you've got your hand up. There's one comment in the chat I want to come to, and then over to you. So Chris, there was a question from Susan. Would you say someone on the receiving end of stigma and disapproval would say that it feels the same?
Yeah, and great question. And I think that's really the crux of the problem, is that without reading the articles and kind of dissecting the theoretical logistics of it, I don't really think that there's any practical difference. And so I'll give you an example. You might go into a health service and just by, and you might tell your story, for example, and someone might, not stigmatize against you per se, but, be disapproving of your lifestyle choices. Now that is going to set off, that I believe is going to be, because of the history that we have of being stigmatized. I think it's just going to feel like low level stigma. It's going to force people to not actually give any more details, to become secretive about, their healthcare, to worry that details that they're going to be used will be given, will be used against them, and can have quite a kind of a snowball effect through that system. So if it's entry into hospital, for example, and then the nurse in ER passes on that disapproval to the doctor with a comment that's then misinterpreted, and suddenly the person isn't getting pain relief for their broken leg, and is leaving hospital early to have really really low recovery rates from that injury, for example. So I think the simple answer is no. I don't think that the difference would be in any way felt by the person who's experiencing it.
Those mechanisms of health systems, like writing things in notes, and there's a great paper which I'll plop in the chat in a sec, from Emily Lenton and colleagues, talking about the kind of technology of the medical records, passing this information on to other places and other times that no control over.
Yeah, exactly. And people misinterpret words a lot in medicine and throughout the world. And so, you do get, with discrimination and tiny little, just the way that people annotate their work, for example, it causes huge issues for down the track and can stay with that person for life, and really have profound implications in terms of what treatment they can access and what they can't access. So yeah, I don't think there's any way that you could actually set up a set of criteria which people could use in service delivery, you know, to have any sort of positive implication from being disapproving of someone seeking healthcare. I also think there's human rights implications around health equity, and people's people's right to seek health treatment without being judged and being disapproved, even if we do just use disapproval. So I think we need to be really careful there. I agree, James, that in terms of kind of broad, overarching, maybe disapproval could potentially be used in some sort of a campaign, for example, like, to some extent, no, it's not a good example, but yeah, I think I do take your point that in some cases you could see that there is some evidence, but I would say even in those overarching kind of education, social norm situations, that always the more empowering, the more educational message, positioning the person at the center of their own world and their own experience and their own health and well-being is always going to have a more positive impact than disapproving messages.
Megan, over to you.
Thank you. I'm so excited just to even have a little bit of a voice. As soon as I saw this, the topic, I was like, oh my gosh, I need to be here for this. This is really fascinating. And I'm a person who used substances problematically and no longer does. And I am a person who works primarily with storytelling and stigma around addiction recovery, mental health challenges, suicidality, all the really super stigmatized things, incarceration, all of it. And I've also worked in the addiction recovery field for 11 years. And so I do want to, like, it's hard for me to do this, but I do want to say, like, I also acknowledge that there can be a point in or a few stops along the way in someone's change process where that identity rejection, that piece can be really important, but I think the distinction is it has to be self-identified, rather than, everybody telling you that what you're doing is bad and wrong, and therefore you are bad and wrong. But there is a tension that I have all the time in my work, which is that self-stigma, the internal stigma. And so American here, we drank the Kool-Aid hard. And so for those of us who use drugs or used drugs, we are as stigmatizing often as anybody out there. And so do we come at it with systems, or do we come at it with individuals? The problem with, is the system ever going to change if the individuals don't address their own stigma? However, like Chris said, we're really tired. We're really fucking tired of fighting all of the battles all of the time. And I think the emotional labor, to be what is asked and expected of us to sort of fight the good fight is so great. And is it really our job? And so I think there's that tension between, like, we have to address our own internal stigma, and are we expected to fix everything from the inside out? Yeah. And so I'm just curious, as Chris especially, but any of you thoughts on that tension that we have to hold when we talk about this?
Wants to pick up that, Chris?
I'm happy to, if no one else wants to have a crack at it first. Yeah, really good point. So self-stigma is something which is highly pervasive and is really, that's one of the main concerns that I have, I guess, with this kind of thing, is that it's not so much the stigma that the worker puts on you, but it's the ongoing effect of how that influences you. And so just even very small stuff can send off this kind of cascade of self-stigma within yourself, the way you feel, and can be profoundly debilitating. And so that is why it's just so crucial to be providing these kind of spaces which are warm, emotionally safe, empathic, empowering, and understanding, at the same time as kind of providing you tools for resilience, so that you can kind of block some of this stigmatizing stuff out that causes cascades of stigma, but also recognize, I really like kind of mindfulness in this area of recognizing when, you know, you're stigmatizing yourself and stopping that. Yeah, so I think and I'm not sure how disapproving I mean, I know how disapproving messages, and they're very, that they do set off self-stigma within myself. For example, I start questioning everything and then kind of thinking, oh, you're not, you know, you're worthless, and setting off all this kind of pathway. And so you can have a message which is, you know, quite benign and just disapproving of something, which can cause some fairly significant ruptures to people's personalities if they're in that moment themselves, especially if they've got kind of a number of layers of stigma, and that part of different marginalized communities. It can be really, really disproportionately harmful, and then that in itself can then, that harmfulness isn't just for the person, that then is reflected in what the person says to others within that community. And so it then spirals, and you end up with a quite a small trigger to cause someone to then self-stigmatize and then stigmatize others within their community, and set off quite a big spiral of negativity and stigma, which then leads to serious discrimination.
This is such a fantastic conversation, and I'm sorry to say we've only got 4 minutes left in our session. So I wanted to hand back to James and then to Chris for some final thoughts. And thank you to people who've been posting in the chat. It's amazing to hear these stories and to keep elaborating these ideas with the expertise that you all bring. But in our last minute or so, to James and then to Chris.
Yeah, I think, yeah, I don't want to speak for long, but just to say thank you for all the perspectives. And I think, yeah, that's I've heard a really compelling case for how important it is that we don't allow people who maybe advocate for disapproval to kind of get more traction because of how harmful stigma is. And self-stigma is, again, such an important part of stigmatization, which I didn't touch on in the talk, but we do touch on a bit in the paper. But yeah, thank you so much for listening and sharing your feedback as well. It's been great to meet you all. Thank you.
Chris, any final thoughts from you?
Well, just thank you for the opportunity to talk at this forum, a really important subject. I just think that this is, I mean, I look around the world and I'm afraid at the moment. You know, there's the rise of a number of these kind of types of rhetoric flowing out on our social media and even in our politicians now across the world, you know, causing real and profound issues, especially to the most marginalized and the most stigmatized. And so not surprised that this ugly one reared its head. Very important to rebut it. And thank you for supporting me. All the comments have been amazing and wonderful, and the understanding of how difficult it is to talk about this stuff as someone who's experienced it has been really warming to my heart. So thank you all for the and thank you, Carla and Co, for allowing this to happen. It's been great. It's been a pleasure.
Well, this was definitely a very deep, challenging conversation, but hopefully we all understand the reasons why we have it, so that we can arm ourselves with the perspectives that matter, which are broad, and all of them are important to help us with a good conceptualization. And Chris, I totally understand. Any of us who live with any kind of difference are very worried about, you know, the futures of the world and our own worlds. So we can only work together to advocate and have a stronger voice. So I want to thank James, thank Chris, thank you all for being here, and we look forward to next discussion. Thanks everyone. Have a good day or evening, wherever you are.